My name is Paolo del Vecchio. I am first and foremost a person in long-term recovery myself from addictions, mental health, and trauma. For me, that means that I began my recovery journey on October the 11th, 1985. So 39 years of recovery for me. And I'm not certainly alone, right? We know from data that we published at the federal level that there are over 60 million Americans in recovery, that fully 70% of individuals who've experienced mental health and addiction issues identify as being in recovery. So what that says is recovery is common, that in fact it should be the expectation for everyone who seeks treatment and care, and that there are many of us, in fact, out there in our communities and our families. At the same time, we know that 90% of people with diagnosable substance use disorder do not receive treatment. We know, of course, that overdose deaths continue across the nation in significant numbers, right? We've had a slight decline in overdose deaths over the last several years. Most recent data just released last week show, as of January of this year, a slight increase again. So we're certainly not out of the woods at all. We've lost far too many people due to overdose deaths over the last decade. We also know conditions like suicide. Of course, mental health and addictions, right, too often go together, and we know suicide is the second leading cause of death among our nation's youth across the nation. So the importance of recovery, the importance of programs like, in fact, the Ridge. I grew up in a family that knew addictions and mental health intimately. My dad was a Korean war vet and was also a professional. He was a health care provider. He was a child psychologist himself. He never talked much about his battlefield experiences in Korea, but dealt with it through the bottle. And so my earliest memories were of the smashing of whiskey bottles in my household, the brandishing of weapons, and my mom, who I consider the heroine of my life, someone who knew serious mental health issues personally. She was hospitalized several times due to her mental health troubles, but went on and got a master's degree in philosophy, raised 4 kids by herself, was a professor at a community college for many years, nationally published poet, community activist, a real model about what recovery is about, was my #1 champion as well. But that early trauma, in fact, that I experienced as a youth, again, not unique, right? Adverse childhood events like I experienced are something that many of us experience, and the data is really clear that trauma contributes significantly to the development of mental health and addictions issues. And that was my case, again, not feeling safe at home. And that led to my anxiety, depression as a child, not interacting with my fellow students. At an early age, the teachers in 3rd grade saw what was going on with me, thought they were helping. I consider it now kind of a case of early intervention done wrong. In that they pulled me out of a classroom in front of my peers to talk to a school psychologist, and it wasn't bad talking to that school psychologist, but the reaction from my peers on the school bus ride home, right? What are you, psycho? What are you, crazy? What's wrong with you? And I can remember crying my eyes out to my family that evening, saying there must be something wrong with me. And frankly, that was the first taste of what we called stigma, right? The prejudice really is what it is, the discrimination associated with these conditions. And that turned me away from seeking services for 20 years, right? Why would I want to have anything to do with seeking care if this was the social ostracism that I was going to face? So instead, as a young person dealing with the pain I was facing, not surprisingly, turning to alcohol and substances to dull the pain. And so drinking grain alcohol as a child before school, getting high on any substance I could get my hands on, methamphetamine, cocaine, smoking dope morning, noon, and night, PCP, you name it, whatever drug I could get my high hands on. And, as a result of those actions being taken away in back of police cars in handcuffs, spending time in jail and booked. And, that traumatic experience in itself, getting involved in criminal justice systems. And then through elementary, through high school, almost on a daily basis, getting bullied from my fellow peers. And we know, again, more trauma. And trauma compounds itself. The more kind of trauma you have, the greater negative outcomes that you'll have on both your behavioral health and physical health as well. So for me, like many of us, that time of transition age of emerging adulthood, 18 to 25, is the time when we see most mental health and addiction issues really begin, and really are oftentimes some of the hardest times in our lives. And that was the case for me. I found myself as a 23-year-old dealing with my addictions, my mental health issues, my trauma. I found myself at a place where I had no friends, where I had no job, no home, no health care, no sense of hope for the future. And I didn't feel my life was worth living at the time, so I made a plan, and my plan was to end my life in front of a subway train in the city of Philadelphia where I was living. So I went down to that platform on October the 11th, ready to take that step, and as the train approaching the platform and the light coming down the tunnel, ready to take that step, and as I was ready to take that step, the thought of my mom pulled me back from the ledge. And I say that because of the power of family, and I know there are many families here with us today, but family support has been, for me and for many of us, the most crucial aspect of my recovery. So I made a decision that day to try to get some help, and I went to the local program that was close to me, mental health and addictions program. I told them I was in crisis. They said, come back in 30 days, we have an opening then. And sadly, we often turn away people in need, oftentimes because of the lack of funding for the programs that are offered to people. But what I found there changed my life, and that was in that program that day. And that was a sign, it was literally a sign on the door of that program for a job. And it was a job actually at another mental health and addictions program in the city of Philadelphia, helping to staff what was called the information referral line. We call it a warm line today. And these were people with addictions and mental health issues calling for help. And I found three things through that job. One, I found I wasn't alone, that there were so many people experiencing the same conditions that I was facing. Second thing I found was that recovery, in fact, was possible, and that treatment and services could be crucial for my journey of recovery. And the last thing I found was the sense of when we help others, we also help ourselves. And this is a real component about what recovery and mutual support's about. When we help another person, what that does to our own sense of value and worth. And frankly, that gave me a sense of my life was worth living, that there was a purpose for my existence. And I went on and dedicated my life and career around assisting my fellow peers ever since that first job. I went on and graduated and got a graduate degree from college in social work, graduated summa cum laude. Went back to work at that program, and, we were involved in a lot of developing of community-based programming, similar to what the Ridge offers here at that time in the city of Philadelphia. And I've also been very much involved in advocacy and policy issues around mental health and addictions. And that particular organization was very active in terms of its advocacy roles in trying to make better services and systems for people. So I found myself one day chained to the doors of a federal office building in Center City, Philadelphia, in a protest around housing and mental health and addictions, and spent a day in jail as a result of that action. But we ended up getting $7 million in new funding for housing as a result of that action as well. And sometimes you have to take those steps, right, in order to get needed change. But I went joke that I went from being chained outside of a federal office building to eventually I got a job within the federal government, where I was chained to my desk inside of a federal office building for 30 years. I went from that job and I made a decision to try to affect change from within the system rather than outside in this nonprofit. And I went to work for the city of Philadelphia in its Office of Mental Health and Addictions, working on homelessness, HIV, AIDS, and others. Some folks will live with you your whole lives. And there was one woman who I'll never forget. And she had been hospitalized in a psychiatric hospital for 50 years. And she had been the last 5 years in the hospital, didn't say a word. And every day, staff at the facility would come, they would lay out her clothes, tell her what TV to watch, what food to eat. She had originally, in post-World War II Philadelphia, slipped probably on a rainy day and on a trolley track in Center City, Philadelphia, hit her head, probably had a case of traumatic brain injury. But yeah, last 5 years, she didn't say a word. We developed a community residential program for her. Every day the staff would come, tell her what food to eat, what TV to watch, what clothes to wear. One day in the morning, she'd been living there about 6 months, the staff came and laid out her clothes, and she spoke up for the first time and said, "No, I want to wear what I want to wear." And that's a little bit about what our work is about what recovery is about. It's about giving people the choice and the power to make decisions in your own lives, to be independent, ultimately, to have power over your addictions and your mental health issues. She went on and lived successfully in that community for the rest of her life. About that time was the time that the federal agency that I worked at for 30 years was founded, SAMHSA, the Substance Abuse and Mental Health Services Administration. And this agency has been very supportive around recovery issues and the involvement of people with lived experience, people in recovery and family members. And every year they do a conference, have a track for families and peers. And one year they decided not to do that particular track at the conference, and this conference was held a few blocks from where SAMHSA's headquarters was, and still is, in fact. People weren't happy that they canceled that particular track, so they took conditions in their own hands and walked over to SAMHSA's headquarters. At that time, it was before the tragedy in Oklahoma City bombing, where you could walk into any federal building. And so people walked in and staged a sit-in in SAMHSA's offices of peers and families. Director of one of the centers there, Center for Mental Health Services, Bernie Ahrens, met with them and issued a letter that I had in my office for 30 years that said that he would hire a person with lived experience to work at promoting recovery, and I ended up applying for that job and was, in fact, the first self-identified, right, person in recovery to work at the agency in 1995. And I just completed my 30-year career there at the end of February, where I found myself in a variety of different roles. I ended up ultimately being the director of the Center for Mental Health Services, where I was in the very chair where those people staged that sit-in so many years before, and to acknowledge again that we stand on the giants of many that have come before us. Interesting story, as I started at SAMHSA, special assistant to the director at the time kind of pictured me as an addict, an ex-patient to come work at the agency, and she pictured me kind of drooling, stereotypical fashion, drooling at the mouth, not being able to communicate, shuffling. And she decided it was going to be her job to take care of this addict, this ex-patient. To make a long story short, 3 years later, we were married. We just celebrated our 28th anniversary last week, and we take care of each other and our 3 now transition age young adult children ourselves, and a 15-year-old aging dog. But I say that in jest, but also we know, I talked about stigma earlier, that the most effective way of overcoming stigma is, in fact, when people disclose, when people come out of the closet, so to speak. And it's a risky thing, right? For some people, because of their jobs, right? Being public is not for everyone. But what we do know is that when people come out, they see us, frankly, beyond the labels, right, of addict and ex-patient and things like this. They see us as people who want the same thing as other people want, right? That we want a life in the community, be with our family and friends, to live healthy and happy lives. I went on the last 2 years as the founding director of SAMHSA's Office of Recovery, and this was the first ever federal office that focused on recovery. And the way SAMHSA defines recovery, we did this through a consensus process with people around the country. We define recovery as a journey. It's a process, because we know these are chronic long-term conditions, right? That we can go to treatment, but this is something we live with for the rest of our lives, frankly. And the need for long-term support. So things like the alumni program that you have here are critical for that kind of long-term support for people. So at the Office of Recovery, we identified recovery as a journey. It's a process for people really to improve 3 things. 1, to improve their health and behavioral health. That means overcoming their addictions, controlling their mental health issues as well. So improving your health and behavioral health, it also means being as independent as possible, to live a self-directed life. And the 3rd thing it means is to try to live and pursue your full potential. SAMHSA, we also identified that there are 4 things that are really crucial to help support a life in the community, and those are health, home, purpose, and community. The importance of accessing quality and affordable health care and behavioral health care. Second thing is home. And we know, and the data is really clear about this, that housing is perhaps the most critical part of the journey of recovery. Having a place where you can go as solace, a place to lay your head at night, a place of refuge. Health, home, purpose, the importance of a job and education, the meaning that it brings to our lives, and the income that it brings to our lives. Health, home, purpose, and finally community, the importance of having supportive family and friends and peers around us. So we look at these areas of health, home, purpose, and community. First, in the United States, when we look at health care access and quality of care, we know that we have way too many uninsured individuals in this country. We know the quality of care is quite lacking in a lot of places. I mean, this is amazing what you have here at the Ridge. You know, I've been visiting programs around the nation, and what you have at the Ridge is really unique in a lot of ways. The quality of the programming that you have here, and you're fortunate with that. When we think about health, it's also not just our mental health and addictions, right? But we know the importance of primary health care as well for our recovery. Data shows that we die decades earlier than the general population. So to put that in perspective, the average life expectancy for Americans today is in their late 70s, rather. So for those of us with mental health and addiction issues, average life expectancy is only in the late 50s, age 58. So I turned 63 in April, so I'm already 5 years past that actuarial, where I should have passed. We know that, so think about that. Age 58, last time U.S. as a population had that life expectancy was in the 1920s. So for those of us with mental health and addiction issues, we haven't had any progress in our life expectancy in the centuries worth of time. Yes, mental health and addictions contribute to that loss of life, but biggest killer is, in fact, primary health conditions, cardiovascular disease being number one, tobacco being a main cause of that, in fact, as well. So the importance of primary care is critical. When it comes to housing, we have over 700,000 people living in our streets and shelters on any given day. Record numbers of people unhoused because we have an affordable housing crisis in this nation where people can't afford in rental or even purchasing a home is out of the reach for many in this country. And so that significantly contributed to the homelessness that we are experiencing more of each and every day. When we think about purpose and jobs, here we see unemployment rates with people with mental health issues of up to 80 to 90%. We know that mental health and addictions, what it does in terms of issues of productivity, what it does in terms of issues of absenteeism on the job are huge and huge cost drivers. Estimate alone that depression costs the U.S. economy $1 trillion each year alone. Health and purpose, and then finally community. We know, again, as I mentioned before, the social ostracism, the stigma that continues to hold people with mental health and addictions back and contributes to the lack of funding and policy issues that these are continued to be conditions that are treated as second-class, frankly, conditions. So we have a lot of work yet to do. We also know that recovery is possible. The 60 million of us are the evidence that we can, in fact, overcome these issues and live full, healthy, happy lives. A few things that are really critical that we know and that align really well with what the Ridge offers is that we know what's really important are comprehensive, holistic care that's also based on individual needs, right? And that, first of all, you have here at the Ridge comprehensive programs, a level of care system from detox to long-term supports. We talk about holistic care. We are offered supports for things like dual diagnosis. We are offered things like music and art and nutrition supports. We talk about individualized supports that are services based on people's individual needs and goals. We also know that the importance that care is, in fact, safe and evidence-based. And again, the Ridge offers that through programs like cognitive behavioral therapy, medication-assisted treatment, all evidence-based practices. We also know that in order to be effective and to achieve recovery programs, need to be innovative. Things like the Ridge offers, like yoga, meditation, acupuncture, are all innovative approaches that help to meet, again, these holistic needs. Perhaps most importantly, that helps to support a life in recovery really is a supportive community around us. And here, again, programs like the professional program that the Ridge offers, those kind of specialized needs, unique needs. When we look at developing supportive communities, the importance, again, of family involvement and family therapy that the Ridge offers. As I said in my opening, family has been perhaps the most crucial thing in my journey of recovery. Not only from the support from my mom, almost 40 years ago, to the support of my wife and family now, today. All my kids have experienced these issues as well, so I'm also a family member as well as a person in recovery. I know how difficult it could be for family members and caregivers to have to deal with these issues, finding your loved ones in the throes of an addiction or mental health issues. Caregiving for anybody with a health condition is stressful, let alone the complications that mental health and addictions bring to the question. So family-based recovery is really critical. We need to support families with things like respite care, if they need a break at times. Having programs like that have been developed around the country for family support, where you have family members assisting other family members. We've also seen the incredible growth of peer support across the country. Of course, AA, right, is almost 100 years old at this point. But the formal peer support world has exploded in the last 2 decades with the development of a new workforce in mental health and addictions. People in recovery like myself and many others who are helping their fellow peers, called recovery coaches, peer specialists, family support providers. States certifying and training peers to work. Why? Because self-help works, right? We know having those connections with people who've had similar lived experiences makes all the difference. When you can find role models of other people who have achieved recovery and made it, you're not alone. You too can also achieve those goals as well. So peer workers have emerged now as the 3rd largest workforce in addictions and mental health care today. 100,000 peer specialists across the country working in treatment programs like the Ridge, to jails and prisons, to within hospital settings, even within places like neonatal intensive care units. We're finding peer specialists and recovery coaches. And this is really changing how care is delivered across the country and really from the inside. And so that's been an exciting development over the last 2 decades, has been the development of this new emerging peer workforce that really, again, talks to the importance of having a supportive community around us to achieve recovery. I'll say, we talk in recovery that the most important thing we can have is hope. And hope is the catalyst of the recovery journey. Concept that, yes, there can be a better future tomorrow, that our current circumstances don't dictate what happens on the next day. We also know that hope and healing, that we can, in fact, overcome these conditions to live healthy, happy, productive lives in our communities. And we know that giving opportunities to give back in our communities makes all the difference. As I stated in my comments here that as that 23-year-old on that ledge of that subway platform, ready to take that step almost 40 years ago, that I find, after the treatment that I received, and I continue to seek care for my addictions and mental health even today, right, almost 40 years later. But if we look at these aspects, right, of health, home, purpose, and community, as that 23-year-old, as I said, without a friend in the world, without a job, a home, without a sense of hope, any kind of community around me, to today that as a federal employee and now a federal retiree, that I have access to some of the best health care there is in this country. I have a choice of 40 different health plans, and I have full parity coverage for my addictions and mental health treatment. Health, as in terms of home, I have gone from not having a house on my own to owning a large 5-bedroom house in suburban DC with a big mortgage, I'll add. But a place where, again, where I can have refuge, a place where I can work on my recovery day in and day out. Health, home, purpose, gone from without a job to having a job that I loved for 3 decades, a job that's enabled me to travel the world, meet with people in recovery in places like Japan and New Zealand and Australia, all across Europe and Latin America. A place where I've contributed and helped to make a difference. Health, home, purpose, and finally community. Again, from not having a friend in the world where I felt completely alone in my life, to having family around me, to having peers across the country that have supported me on my journey, to having my own coworkers and friends support me on this journey. So, my journey in many ways is not unique, right? The story of transformation is what recovery is about. It's about going from a place without hope to healing and finding the opportunity, in fact, for a better tomorrow. And that's what the Ridge provides us. It provides you with that support, provides you with that sense of community so that you can get your life back. Recovery is life, as the saying of the Ridge goes. And I'm just one example of that. You all here in this room are also examples of really finding and embracing life, and that's what recovery is about. So I appreciate the opportunity to be with you here today. I could talk a lot more about some of the current policies and practices, in fact, that are going on at the federal level, and it's not all pretty. I'll say that. And we're facing major changes, without being too political here. But we're making major changes in, Medicaid, things like food stamps, things like the federal structure itself, with SAMHSA itself being proposed for elimination. We're not sure what the future may be in terms of these issues, but the importance of community-based efforts like what you have going here at the Ridge is where all the difference happens. You can have the federal policy, but if you don't have these kind of programs within the local communities, then in fact, it won't make a difference. So thank you for your own particular journeys of recovery. It takes incredible amount of courage and bravery, in fact, to take on these journeys of recovery. It is not easy work. And you have to work on it day in day, but frankly, the benefit, the opportunity to see my children being born, the opportunity going to my daughter's wedding this past May, the opportunity to celebrate my anniversary with my wife for 28 years, this was all because of the treatment and recovery that I've experienced. And these are things that everyone in this room really can embrace and continue to embrace that life in the community. That's what it's about. So thank you for the opportunity to be here today.